Where the upper limb goes from mobility over stability, the lower limb is the other way around, so it can bear a lot of weight, but the field of movement is more restricted. It centres on the pelvic girdle. The hip bone is divided into 3 different bones. The pubis, you can see with the pubis with its tubercle here. Superior and inferior ramus. Ramus just means a branch. The inferior sometimes being known as the ischiopubic ramus because it connects the pubis with the ischium. The pubic crest or the pubic symphysis is this bit that joins to the corresponding bone on the other side. The crest is the bit at the top. Got a line across the top of the ramus called the pecten pubis. Pecten. And this hole here is called the obturator foramen. So if we go to the ischium, the ischial ramus, ischial spine, and lesser and greater sciatic notches. This is the ileum with the iliac tuberosity or tubercle, which just means a warty outgrowth from a bone. The auricular surface, which articulates with the sacral bone. Arcuate line. Anterior superior and anterior inferior iliac spines. And correspondingly at the back, the posterior inferior iliac spine and the superior iliac spine. And finally the iliac crest. On the other side of this view, you've got the acetabulum, which is where the head of the femur inserts to form the hip joint. And all 3 bones meet in the middle. There are only 3 exits from the pelvis for neurovasculature going to the leg and perineum. The posterior route through the greater sciatic foramen, bordered by the sacrotuberous ligament, running from the sacrum to the ischial tuberosity. That's the sacrotuberous, and the sacrospinous, between the coccyx and the ischial spine. Remember, the ischial spine is this thing here. So that's sacrotuberous and sacrospinous. Greater sciatic foramen. Now this leads to the gluteal region of the leg at the back of the leg and carries all the vessels to this area, plus some of the internal pudendal vessels. It also carries the pudendal nerve, as well as the inferior and superior gluteal nerves. The anterior root goes underneath what's called the inguinal ligament, which runs between the pubic tubercle here and the anterior superior iliac spine here. So that's the anterior root. And then the femoral vessels and the nerves to the anterior thigh go under this area. Now these gaps here are the obturator canals. They're mostly covered by obturator membrane, but there's a small gap which allows the passage of the obturator artery, obturator vein and obturator nerve to the thigh. This is the medial route, and that's through the obturator canal. The greater sciatic foramen is crossed by the piriformis, with some structures entering before and after it. The lesser sciatic foramen is this bit here, but it's not as important in terms of vessels and arteries. The fascia of the thigh is called fascia lata and is attached to the inguinal ligament in front and to the iliac crest posteriorly. The specialized thickening of the lateral border of the fascia is called the iliotibial tract, named because of the attachments inferiorly onto the anterolateral aspect of the tibia. There are two sites of perforation, and these are points of weakness. At the back of the knee, known as the popliteal opening, popliteal fossa, and the saphenous opening, which lets the anterior structures like the femoral artery out into the thigh. Remember, the femoral artery comes through the anterior root under the inguinal ligament. So that's the saphenous opening. So the fascia of the thigh is fascia lata, continuous with the crural fascia of the leg. The femoral nerve supplies the anterior part of the thigh. The obturator, the medial, corresponding to the compartments that they travel through. Posteriorly and through the posterior compartment, the sciatic nerve is divided into the tibial part, which is the upper posterior part of the thigh, and the leg, and the same nerve as the fibular nerve. The femoral nerve is also responsible for the cutaneous innervation at the front of the leg, lower leg. These two derive from the lumbar plexus, and the sciatic comes from L4 to S3. There are 4 pulse points on the lower limbs, the most important being the femoral, which can be palpated at the mid-inguinal point, which is not the midpoint of the inguinal ligament, but the point midway on a line between the anterior superior iliac spine and the pubic symphysis. Now, to take the pulse, you go 2 or 3 centimetres below this point. The popliteal pulse is taken at the back of a flexed knee. The posterior tibial pulse just behind and below the medial side of an ankle. And the dorsalis pedis pulse on the top of the foot, known as the dorsum of the foot.